Hello everyone and welcome back to our initiative, What After Dentistry. As you all know, we are a team of dentists with healthcare management background, and we are here to guide you and make you aware of the various career options in dentistry and healthcare. Now today, we again have Dr. Alex Matthews with us, a consultant prosthodontist, implantologist, and principal of Rajas Dental College and Hospital, Tirunelveli. Dr. Alex is a part of the international panel of the University of Genova and lectures for its programs around the world. He's an eminent speaker of laser dentistry, having many ongoing research projects. He's also on the editorial board and an elite panel of reviewers of several international journals. As you all know, we have already conducted a session with him earlier on scope and opportunities in laser dentistry. We welcome you, sir, once again on our platform to talk about implantology. Welcome you once again, sir.
Thank you.
So, sir, we would like to know what is the current scope of implantology and how can one practice this field during the pandemic?
Okay. Thank you, Dr. Shireen, once again. And implantology as such, in terms of the pandemic, we've been very, very innovative in dentistry in handling the pandemic. We have got all kinds of support from the industry also, which has helped us. We've come out with so many innovations during the pandemic. One of them, just to show towards our participants, let me just show you this one. This is from Confident Industries, where we have this as one of the filters that allow us for our practice in making our practice more safe. Now, my point is where we have gone, where have we gone from, and where we have arrived at. We have been as dentists, we have been, some of us even have gone into the manufacture of PPE kits and mouth masks as such. I know one of my colleagues, a young colleague of mine named Karnav Patel. Karnav Patel is an oral surgeon in Ahmedabad who is all into making not just any N95 masks, but the best N95 masks the market has to offer. Okay, if you were to go abroad, you won't get, if you were to go anywhere abroad also, you won't get the kind of quality that he accords for his N95 mask, which is completely safe, and his PPE kits, which has got complete safety, and it has got even to facilitate your breathing, it has got integrated breathing apparatus that is part of your PPE kit as well. So let me tell you that in terms of implantology as such, if you are in the practice of implantology, you need not fear that the pandemic is going to create a block towards your practice. If you are innovative enough, if you are if you are willing to take the necessary precautions, then it should not stop you from your implantology practice. I myself have not been restricted to implantology practice during the pandemic. Of course, it entails wearing off the PPE kit. You have to wear, not just wear your PPE kit, but you also have to wear the face shield that comes over your N95 mask. And I also use a 3M goggles that goes over my own spectacles, my working spectacles that I work with. Now, if you're able to withstand, if you're able to bear up with wearing this PPE kit and the face shield and this thing, let me tell you, it drains you out completely. It drains you out completely in that at the end of the 1 hour or 1 hour, 15-minute session of implantology, your shirt will be completely drenched. Your vest, you can just wring it dry of the sweat that you have. But I'm telling you, that is a premium that you give to your patient, the protection that you give to your patient in your practice, that is the premium that you are paying for it. But if you're willing to do that, that does not stop you from actual implantology practice. Let me tell you another tip. I don't work with one set of gloves. I use 2 gloves, or sometimes even 3. I use 2 gloves. Why? Is that an overkill? I use 2 gloves. Why? Because I have a second layer of gloves which I wear for intraoral what I'm doing. And when I'm going to touch any of the, let's say my physio dispenser settings, I remove one set of gloves and I have the underlying glove under which, the underlying glove which I use for, which is also sterile, which I use for touching the physio dispenser. So what I'm trying to say is that you need to minimize your contact, the contact that you come into with blood and saliva, which is directly frank blood and frank saliva from the patient's mouth. You need to minimize that into your contact surfaces. And before and after any of the procedures that you would do, you will have to disinfect your chair, your trolleys, your entire operatory. And what I do for one is that I keep a pedestal fan. I keep a pedestal fan behind me, and it always blows over my left shoulder. It always blows over my left shoulder. Why left shoulder? Because I'm a right-hander. And if I put the pedestal fan towards the right side, when I'll be blocking it with my right shoulder. Since I'm a right-hander, if I allow the pedestal fan over my left shoulder, I'm not blocking it. So any aerosol which is directed is gathered away towards the window side. I do not use air conditioning in my practice. Ever since the pandemic started, I do not use the air conditioning during my procedures of fixed prosthodontics or implantology. I do not use air conditioning. I only use air conditioning, and that too, believe me, that too, if it is just a diagnosis and treatment planning for a patient whom I'm familiar with, who has no history of travel, who has no corresponding family members who have traveled, and who I'm comfortable that he's coming from the neighborhood. Otherwise, I do not put air conditioning. I leave my windows open. My Venetian blinds are open and draped up. Not just open, they're draped up. And they are open directly with the this thing. There's a free flow of air from behind over my operatory that is directed towards the windows which are in front of my, or towards the other side of my chair. Now, what I'm trying to say in direct answer to Dr. Shireen's questioning is that I do not think, I for one do not think that the pandemic should stop you from practice of implantology, practice of fixed prosthodontics, or practice of endodontics as such. We have practiced now, God willing, by the grace of God, I have practiced from all through 2020 to 2021. 2020, mind you, I had taken strictly the orders of my government, the central government lockdown from March 22nd onwards till the lockdown was released in May. We strictly had not opened our clinic. I also have a 3M respiratory mask. I do not use the 3M respirator mask. It is called an FFP3 mask. I do not use it for implant procedures. Why? Because if I wear that respirator, when I say something, my assistants can't make out what I'm saying, and it's like I'm like an alien to them. So I don't wear that during implantology. I only wear the PPE kit with the face shield and N95 mask with a double 3 or 4 ply mask over it. I don't use the 3M. I use it during my FPD cases. but I don't use it as I do not think that the pandemic should stop you from your practice, of course. But the last point that I added, we should follow government directives. We will win, and Jai Hind, we will come out of this definitely.
Yes, absolutely, absolutely. So, sir, we know that we have so many hands-on courses in implantology. What would you suggest to the audience or to those graduates who want to pursue implantology? What should they expect out of a course? And while they are going through or while they are pursuing this course in implantology, what are the skills that one should acquire or one should command on?
Okay, it's an excellent question. Let me just thank Dr. Shireen for that. The first thing that I would like to point out to you, when you're going to do a course in implantology, and the necessity of taking a course we had mentioned in the last session. You need to do a course. Why? Because only if you do a course, you will be confident within yourself to be able to convince a patient. See, if you're not convinced yourself, you can't convince others. So you need to be confident about your knowledge about that particular field or that particular aspect. Then only you can convince a patient to subject himself or choose that treatment option of implantology that you're going to provide. For that, you need to do a course where you can be taught the intrinsic aspects that will keep you in keep you steadfast in the practice of implantology. So that's what I'm going to say about doing a course. See, I would recommend a course where it will not be only theoretical. It should be clinically oriented. A course should be clinically oriented. I recommend University of Genova's courses to you. Yes, another course I would recommend to you is Dr. Jabin George's course in Cochin Implant Institute. Why? Because Dr. Jabin does not go on blabbering about only the theoretical aspect. He talks a lot about clinically oriented part. Okay, now that is where you need to capture, because the theoretical aspect you would have learned from Carl Misch, you would have learned from your college, you would have learned from your teachers in college itself. But the clinical aspects of it, you would not have absorbed unless you have a mentor who can guide you with the clinical aspects of it. Let me tell you one aspect. I told you in the last session about uncovering of the implants in the second stage of lasers, using lasers in the second stage of implantology, uncovering the implants. Okay, how do you know where the implant is? When your tissue is completely healed over, how do you know where the implant is? I'll give you a tip. You know that surgical stent you use, the acrylic surgical stent you use to place that implant? Don't throw it away. Keep it. Keep it till the patient comes back to you in the second stage. Where the patient comes back to you for the second stage, you just have to place that stent over and you know exactly where your implant is going to be, so that you just need to direct your laser through that surgical stent, and that gives you the position of the implant. So these are aspects which a mentor only can teach you clinically and not otherwise. And let me tell you, the present aspect of implantology is not just about delayed implantation where you extract a tooth and then it heals and then you go into drilling again. The present implantology is about immediate implantation, extracting that tooth and placing an implant then and there itself. Okay, now there are ways you can do it. You can drill through that tooth in a root membrane technique or a socket shield technique. Both are the same. Okay, now these are confusing aspects, aren't they? On one aspect, you hear someone talking about socket shield technique, another person talking about root membrane technique. Both are the same. Both are the same. But how do you achieve it? How do you achieve it? Now, there are various ways to do it, but to use a good kit and to use a good kit in the judicious and the correct way, only a mentor can train you for that. Otherwise, you get the kit, from the company, but you don't know how to do it. And you talk about, okay, bundle bone and all that, but where exactly, when you open it and you see all the blood in that area, where do you say bundle bone? So you need a mentor to guide you with it. So that is one way. Another way is you don't have the kit at all. You can use periotomes. You use periotomes for an atraumatic extraction, or you use your hard tissue laser for an atraumatic extraction. You shear the periodontal ligament and you take out the tooth, and you can go in directly with your implant. But how far should you go with that implant? How far? Okay. You need to follow the zenith of the gingiva, one reference. Another reference is the CEJ of your adjacent tooth. CEJ. When there's blood all around, you can't see another reference. Okay. You need to look at the CEJ of the adjacent tooth, and the implant collar need to be 2 millimeter below the CEJ. Below the CEJ. Why? Because there is going to be bone resorption. There is going, whether you want it or not, bone resorption is a fact of life you need to live up with. So you need to go in there. So when you're doing your osteotomy, you have a wide socket. You don't need to go in with your pilot drill. I've seen people do that, immediate implantation. They do that, this thing, and then they do that extraction atraumatically. Well done. Then they go in with that drilling sequence right from the 2 millimeter twist drill, and then they go pilot drill, lancet. You can go in with your 2 millimeter twist drill. You don't need your lancet anymore. Okay. So what I'm trying to say is that these are aspects where you need. So what am I saying? A direct answer to Dr. Sharon's question is you need a clinically oriented course, not just a theoretical. How do you know that? Ask for the brochure, ask for the course content. And then in the course content, you can see what is going to be discussed each module. How many hours are going to be given for didactic sessions? Didactic sessions meaning lectures, theory. How many aspects which is going for didactic sessions, and how many aspects which is going for clinical training. So how many hours? It needs to be in a ratio. What is a ratio? If you are going to have 3 hours for theory, they need to be around 6 to 8 hours of clinical. So what am I saying? Theory needs to be around 2/3 and the rest need to be clinical. Then only are you going to be well trained. Now, that is about clinically oriented. Second thing, you need to be trained on taking you from basic implantology, that is right from the suturing technique, right from the anatomic landmarks, and taking you through into advanced techniques. What am I talking about? Advanced techniques? Sinus lifts, okay, sinus lifts. Then GBR techniques. When you're talking about sinus lifts, there is a lateral window technique, which is lateral window techniques, the old thing, my dear friends. It's a old techniques. Okay. Crestally, minimally invasively. Have you heard of the MITSA technique? Minimally invasive transcrustal approach. Okay. Now, if you're going for the transcrustal technique, how do you do that? How do you do inject the graft material? These are things you can learn only from a good mentor guided course, and that is where you need to concentrate upon. That's what you need to select upon. Basic accreditation courses should have one. It should have hands-on. It should not be only demo. Should have hands-on on an artificial substrate. It can be sheep or a goat jaw. It can be a goat head for sinus lift, but it need to be having a hands-on. And second thing, it need to be having a certain amount of hours that are set apart for hands-on and actual implant placements. Then only you need to go for a basic accreditation course, select it accordingly. Okay, thank you.
I think that's great. So as Sir correctly said, you need to go for courses which give you more of clinical exposure and not just theory. And of course, also always see what is the course content that is being taught. How much is the theory part and how much are the clinicals. That ratio needs to be as per what Sir has suggested. And of course, the latest advancements that are happening in implantology is something also that only a good mentor can, guide you on that. So these are certain aspects on the basis which you should choose your course in implantology. So I think these are very well said tips and one should absolutely follow. So thank you so very much, sir, for joining us once again and sharing such beautiful and such, very important advice and tips that generally students are not given in the college, because of course there's a time constraint, and then the major thing is to teach students and to make them equipped with the dental knowledge and not the real what happens in the real world. So thank you so very much for sharing these tips. I think these are definitely going to help out the students out there. And once again, thank you very much for joining and sharing everything with us. All the listeners, all the audience, if you're listening to this session, thank you very much for patiently listening to us today. I will see you in the next session. Until then, and before I say bye, please subscribe. It's free, absolutely. Like and share this in your network, because this is going to help out somebody who is looking to learn about implantology. So thank you, everyone. I will see you in the next video. Until then, bye and good luck.
Thank you. Thank you, Dr. Shireen. Thank you, Dr. Vipin Vasudev Pai. Thank you so much.
Thank you so much, sir.